It is the last month of 2025, which means in about a month, Idaho lawmakers will head back to the state capitol for the 2026 legislative session. What's top of mind for one Idaho doctor? Seeing a revision to Senate Bill 1329. The law was meant to amend Idaho's Parental Rights Act by preventing medical providers from performing medical procedures on kids without their parents' consent. It was described by its sponsor, Senator Kelly Anthon, in February 2024 as a simple bill.
It simply deals with the ability of parents to make decisions regarding health care and medical procedures for children. It simply says that no health care services to a minor child can be done without obtaining the consent of a parent. Just stop and think about that.
It was one that was supposed to strengthen parental rights, but instead has tied doctors' hands when kids show up needing help. As our Hunter Funk explains, one doctor first brought up the concerns when it became a law, but now several months later, he is sharing what damage has been done and what needs to change.
The new law has changed the way that I practice.
Idaho's medical consent law requires parents to sign off before doctors can treat any minor, unless it's a life or death emergency. And parents can sue if doctors don't follow that law. It was pitched as a way to give parents more protection and authority. But in months since, Benjamin Romney, who practices in Burley, says it's done something else entirely.
Pretty much all doctors are okay with always seeking out parents to get consent. But the reality still exists that there are patients who can't get care when they need to. Not everybody has parents who are in the state. Not everybody has parents who are available when they need them. Some parents are working in it. And the trouble is that this affects people who have the hardest time accessing resources.
Romney told us earlier this year he was concerned about turning teens away for things like routine care, mental health support, prenatal care, and even forensic exams after an assault, simply because they couldn't reach a parent. Some clinics started using blanket consent forms asking parents to pre-approve treatment months in advance, just to avoid getting stuck. But for kids without reliable guardians or whose safety depends on keeping certain care private, that workaround doesn't work.
There are people being trafficked here, and as much as I don't want that to happen, it does happen, and those people still need medical care. And so what happens in a healthcare system when you have people that aren't able to access care is they go to emergency rooms, they show up without any prenatal care, so you have worse outcomes. That's worse for everybody. And so things that can be easily prevented then become more commonplace. And problems that really should be prevented become a lot bigger issues.
Bigger issues that he says will keep growing unless something changes. With the 2026 session just weeks away, Romney says he's met with the bill's sponsor, Kelly Anthon, and is optimistic that lawmakers will take another look.
I have been really lucky to meet with some legislators, and everybody that I've met with, both Clay Handy, Kelly Anthon, they're really open to fixing this. This was never something they intended from this legislation. And that's what I think we need to acknowledge, that this was an unintended consequence of the law.
Now, Romney says the issue isn't about taking parents out of the picture, but rather trying to get them involved. They're making sure kids aren't left without care when a parent isn't in the picture. While he believes rescinding the law would be the best step, he does not believe lawmakers will do that, and says the next best option is to relax the consequences so doctors aren't criminally punished for stepping in. Now, it also should be noted that when Governor Brad Little had signed this into law, he said there are concerns. He saw these concerns, and he urged stakeholders to monitor any negative consequences before it happened, and if it did happen, to make amendments to address the issue accordingly. So here we are.
It'll be interesting to see if this comes up and how quickly from lawmakers, because we always hear about, oh, well, we didn't think about that. So we'll see if they address it in January.
Yeah, I guess we'll see.
But at least one compelling argument to at least take a look. Very good. All right, Hunter Funk, thank you so much.